Hi, this is Josh, Dream Body Clinic, and today we're going to talk about the best way to administer MUSE cells. So MUSE cells are a pluripotent stem cell. They're a new treatment for us, but they've been around since 2010. And in this video, if you stay to the end, you'll see Dr. Dezawa. She's the professor from Japan that discovered them in 2010, is at our clinic explaining to me and the team just how these work and the best way to administer them. So with mesenchymal stem cells, we've been doing over 8 years, we'll typically hang a bag of saline, inject the stem cells in there and let it drip over the course of, say, half an hour to like an hour. With the MUSE cells, we want to go direct. So we still hang the line, and you'll see, and hopefully we can edit it in here, me getting treatment. I did it yesterday, but they put the line in my arm and we hang just a small bag of saline. It's like 100 milliliters, but there's always a port on these catheters that you can inject medicine direct instead of letting it drip, so that we then administer the MUSE cells direct into the vein, and just boom, they're right in you. But we're also dripping saline too, just to keep your veins flush and well hydrated. So it's very quick administration. We figured, hey, we've got you hooked up to an IV. We should give you some vitamins too. You're already there, already got the line in you. So just like the mesenchymal stem cells, we then put in vitamin C, CoQ10, and NAD+. These are just different vitamins that help you feel better, give you, more support to the stem cells to do their job, because these MUSE cells are going to go through your body, seek out inflammation. They start eating damaged or bad cells, and then they differentiate into them. It's beautiful. So you got, bad heart, bad liver, bad kidneys, nerve damage, brain damage. They're going to go there, eat the bad cells or bad neurons, and then turn into them. It's really incredible. So we're now offering these. You can take a look at our new website, www.dbcmusecells.com, and stay tuned. You can hear the same thing with our conversation with Dr. Dezawa.
And how do you recommend, we do the IVs with saline solution, we use a pump and something to take control of the solution. We pass 500 cc's in 20 minutes. So that's a good time for the MUSE cells, or do you recommend to put a straight, direct, or?
We usually did in a drip.
Okay.
So we put in Japan, we preserved the MUSE cell in a legal acetate solution with a Demso, and then we washed it, and then I think we put it into some, very small intravenous drip, like 100 milliliter, or sometimes they say that one single shot with the syringe will be. You
can inject it fast, and it's not we don't have a risk the thrombosis or something
if you dilute in
a side.
It will be no problem.
Yeah, I think we can control it with the same trade.
That, for example, because pero esos ¿verdad? Los vitamins, drips,
Yeah, but it doesn't affect it if we add, or we try to complement the IV with some vitamins, just antioxidant like vitamin C and it plus CoQ10. So it doesn't matter.
It doesn't matter.
Okay, and it's okay if the saline solution or the MUSE cells stay away, for 20 minutes or something
We usually inject it within 15 minutes.
15 minutes.
Yeah, 15 minutes.
Okay.
Within 15 minutes or within 10 minutes.